Welcome to the deep dive. We've got some fascinating research to dig into today, louping ill virus in UK dogs.
It's certainly a hot topic, especially with all the attention on tick-borne diseases these days.
Right. And this 2024 study from the Veterinary Record really dives into the nitty-gritty. We're talking seroprevalence maps, technical details, the works. So where do we even begin? What's the most useful takeaway for our fellow vets tuning in?
This deep dive should give them the knowledge to confidently discuss LIV with clients, especially in areas where it might be flying under the radar.
Okay, so practical knowledge, not just a textbook recap. Love it. Let's start with the study itself. Over 200 dogs in England, right?
Yes, 200 to 2 to be exact. Their blood samples were tested for live antibodies using the heme agglutination inhibition test.
And that's where things get interesting because their findings challenge some of the traditional thinking about where leave is most common.
Exactly. We often associate LIV with those upland areas of the UK, but this study found a surprising number of seropositive dogs in southeastern England.
Southeastern England? That's more known for its beaches, not rolling hills and moorlands. What's going on there? Are we seeing LIV spread to new areas?
It's definitely possible. Climate change, changes in land use, even something as simple as increased travel could be influencing tick populations and the spread of tick-borne diseases.
So those traditional geographical boundaries we've relied on might be blurring.
It really highlights the need for vets to stay adaptable and informed. Just because an area hasn't been considered high risk for a specific tick-borne disease in the past doesn't mean we can let our guard down.
So no more mental shortcuts based on geography.
Got it. Now, this cluster of seropositive dogs in southeastern England, how do we know it's actually LIV we're dealing with? Couldn't it be other tick-borne infections like TBEV, which we know is in that region?
That's a great point, and it's one of the key takeaways from this study. The test they use, the heme agglutination inhibition test, or HAI test, can sometimes cross-react with antibodies from other flaviruses like TBEV. So we need to be careful not to jump to conclusions based on a positive HAI test alone, especially in areas where you might have multiple flea viruses circulating.
Exactly. A thorough history and clinical examination are even more crucial in those cases.
So it's like putting together a puzzle. We've got one piece, the positive HAI test, but we need more information to see the full picture. Speaking of which, how common was LIV exposure in those 202 dogs?
They found that 4.5% were seropositive for LIV.
4.5%, huh? Might not sound like a huge number at first glance.
But when you consider the sheer number of dogs we see in practice,
it does make you wonder how many cases we might be missing.
Underreporting is always a concern with a disease like LA. Vets might not be testing for it routinely, either because they aren't familiar with it or because the symptoms are vague and easily confused with other conditions.
So cases could be slipping through the cracks, which makes it even more important to talk about those symptoms. What should we be on the lookout for?
Think neurological signs. Ataxia, paresis, seizures, even subtle behavioral changes. LEV can manifest in a surprisingly wide range of ways.
And to make it even trickier, the study didn't find any clear risk factors for LIV seropositivity, did it?
You're right. They looked at breed, age, lifestyle, even the use of tick preventatives, but nothing jumped out as statistically significant.
So we can't just look at a dog and say, oh, you're low risk or you're high risk. It's not that simple.
Exactly. It really underscores the importance of having open and honest conversations with all clients about tick prevention and the potential risks, regardless of their dog's lifestyle.
Speaking of tick prevention, they did find a potential link between acaricide use and a reduced risk of LAS seropositivity, even if it wasn't statistically significant.
Absolutely. It makes sense, right? If you can prevent the tick bite, you're breaking the chain of transmission.
An ounce of prevention is worth a pound of cure. But even with prevention, we need to know what to do if we suspect LIV. How do we confirm a diagnosis?
That's where it can get a bit tricky, and it often depends on the individual case. We've talked about the HAI test and its limitations, but there are other diagnostic tools available, each with its own pros and cons.
Okay, let's delve into those a bit further then. If the HAI test isn't the be-all and end-all, what other tests should we be aware of?
One that comes to mind, especially when we need to differentiate between different flaviruses like LIV and TBEV, is the plaque reduction neutralization test, or PRNT.
PRNT sounds pretty high-tech.
It is a specialized test, often requiring samples to be sent to a reference lab, but it's incredibly valuable because of its specificity. Basically, they pit the virus against antibodies from the patient's serum, if those antibodies are a perfect match for that virus.
They neutralize it like a lock and key.
Exactly. And the degree to which they can neutralize the virus tells us how specific those antibodies are. So if you have a dog with neurological symptoms, a history of tick exposure, and a positive HAI test, sending a sample for PRNT might be necessary to get that definitive answer.
It's like calling in the cavalry for that extra level of certainty.
Right. But we always have to weigh the benefits of that extra specificity against things like cost and turnaround time.
It's about being strategic with our testing. This deep dive is already proving to be enlightening, and we're just getting started. So we've tackled diagnosis, but what about treatment? Can we target LIV specifically?
Unfortunately, no. There isn't a specific antiviral for LIV. Treatment is mainly supportive care, managing those neurological symptoms and helping the dog's body recover.
So things like IV fluids, anti-seizure meds if needed, maybe even physical therapy later on.
Exactly.
Yeah.
It's about providing that overall support while the dog's immune system does its job. And that's where it becomes really important to prepare owners for the road ahead.
Because even with the best care, complete recovery isn't guaranteed, is it?
Right. The long-term prognosis for dogs with LIV can really vary. Some dogs bounce back fully, while others might have some lingering neurological issues.
So we need to have those honest, sometimes tough conversations with owners about what to expect.
Absolutely. We have to be realistic about the potential long-term effects, like problems walking, seizures, or even behavioral changes.
Right, it's about being a partner with the owner, not just fixing the immediate problem. I guess that starts with a good understanding of what the research tells us. So let's zoom in on the study's methodology a bit. They used samples from over 200 dogs. Where did those samples come from?
They took an interesting approach, actually. Instead of recruiting dogs specifically suspected of having LIV, they used surplus serum and plasma samples that had already been collected for other reasons.
Wow, so they were being resourceful.
Yeah.
Makes sense. Especially ethically, no need to put dogs through extra procedures. But wouldn't that introduce some limitations?
It does. Because those samples weren't originally collected with LIV in mind, there's a chance that some dogs with neurological signs didn't have their symptoms fully investigated at the time.
So some pieces of the puzzle might be missing.
Precisely. It really emphasizes the importance of taking a really comprehensive approach to neurological cases in our own practices, even if they don't immediately scream LIV.
Good point. Now, tell me more about how they analyzed those samples. We talked about the HAI test, but they must have had a system for interpreting the results.
They did. A titer of 1.10 or greater on the HAI test was considered positive for LIV exposure in this study.
Okay, so that's their cutoff. But as we've discussed, the HAI test isn't perfect, especially with those flaviruses. How did they account for that in the study?
They acknowledged that limitation up front, stating that some positive results might actually be due to other flaviruses like TBEV. They stressed the importance of looking at the results alongside the dog's clinical signs and history.
So it's not just about a number on a test result, it's about connecting the dots.
Exactly. And that's such a key reminder for all of us. Test results alone don't tell the whole story.
Now, remember those seropositive dogs clustered in southeastern England? The researchers did some digging into potential risk factors in that region, right? What did they find?
They looked at several aspects of those dogs' lifestyles. They didn't find any statistically significant associations with LA seropositivity, but there were some interesting trends.
Interesting, like what?
One that stood out was the possible link between using acaricides and a lower risk of LAV seropositivity. It didn't quite reach statistical significance in the study, likely because of the smaller sample size, but it aligns with what we know about how those preventatives work preventing tick bites.
Makes sense. Fewer tick bites, less chance of those nasty things hitching a ride and spreading disease.
Exactly. We need more research to confirm this link for sure, but it emphasizes just how important it is to talk to clients about tick prevention.
It's not just about those itchy bites. It's about potentially preventing much more serious health problems.
Right. And this is where that whole One Health idea comes in. It's not just about individual dogs. It's about the health of the whole ecosystem.
It's true. What we do as vets can have ripple effects. So, beyond advocating for tick prevention, what are some key takeaways from this deep dive? What should vets listening be thinking about in their practice?
I'd say the biggest takeaway is to be more aware of LIV as a possibility,
Yeah.
especially in dogs with those vague neurological symptoms and a history of tick exposure, even if they're not from a typically high-risk area.
So no more brushing off those wobbly walks as just old age without thinking about Levy.
Exactly. We need to be those tick detectives, asking detailed questions about lifestyle, travel, tick exposure. Catching it early gives the best chance for a positive outcome.
Early detection is key. Like in those medical dramas, if only we'd caught it sooner.
Exactly. And if we do suspect LAV, we need to be ready to navigate those sometimes confusing diagnostic paths.
We've talked about the HAI test and PRNT, but any other diagnostic strategies to keep in mind?
Sometimes it's just as helpful to rule out other possible causes of neurological signs as it is to confirm LAV directly.
So a process of elimination. Look for other culprits, and if those don't fit, LEV becomes more likely.
Exactly. And that's where our knowledge of other neurological conditions and our diagnostic skills really come into play.
It's like being a detective, gathering all those clues to solve the case.
Precisely. And often, the most important clue is the one that doesn't quite fit.
It's those unexpected findings that often lead to the most interesting discoveries. Speaking of unexpected, I'm curious about the long-term implications of this study's geographical findings. If LAV is expanding its territory, what does that mean for the future, for dogs and even humans?
That's the big question, isn't it? It takes us back to that one health concept we talked about.
Right, the health of humans, animals, the environment, all connected. This deep dive has been eye-opening. I feel like we've just scratched the surface. It really makes you think about all the connections out there. But hey, if it involves helping dogs and unraveling these medical mysteries, I'm all in.
Me too. And this LIV study, while it focused on dogs, does bring up some interesting questions about the bigger picture.
Okay, lay it on me. What kind of questions are we talking about?
Well, we've been discussing LIV in dogs, but what about other species? Could dogs actually be sentinels for human risk?
Now that's a thought-provoking question. We always talk about dogs being vulnerable to these tick-borne diseases, but could they be unknowingly spreading them to humans too?
It's possible. Dogs love to explore all those nooks and crannies where ticks hang out, right? And then they come home, share our space, even our beds sometimes. They could easily pick up infected ticks and bring them closer to us.
So it's not just about protecting our canine patients, it's about public health too.
Exactly. This particular study didn't look at dog-to-human transmission of LAV specifically, but it really highlights the importance of thinking about those One Health connections. What affects animals can often affect humans, and vice versa.
We're all in this together, as they say.
That's right. And the more we learn about these zoonotic diseases, the better we can protect all species, ourselves included.
Well said. This deep dive has given us so much to consider. Diagnostic challenges, LIV's changing geographical spread, those broader One Health implications. It's a lot to take in.
It is, but that's veterinary medicine for you, isn't it? Always learning, adapting, and trying to understand these complicated issues.
And that's what makes it so rewarding. Before we wrap up, any final words of wisdom for our fellow vets out there? What's the one big takeaway you want them to remember from this deep dive?
I think the most important thing is to stay curious, stay informed, and never underestimate the power of a good history, a keen eye for those subtle clinical signs, and a willingness to expect the unexpected.
Wise words. We might not have all the answers when it comes to IV, but by continuing to learn and keeping an open mind, we can keep piecing this puzzle together and provide the best care for our patients. Thank you for joining us for this deep dive into louping ill virus in UK dogs. From Vet Neurochar, keep those minds inspired, hearts light, and tails wagging.